For a respiratory therapist, for a pulmonologist, for a neurologist who's working with people with ALS, really important for them to know that there is a new option for respiratory care for people living with ALS that can extend their life, give them a better quality of life for a longer period of time. The VOCSN multifunction ventilator combines all of the therapies that ultimately they're going to need throughout the disease progression. They can get it day one. They can learn one operating system and be comfortable with that, both they and their caregivers, throughout the disease progression. Whether they start off with mouthpiece, move to non-invasive, maybe eventually move to invasive ventilation across a comprehensive set of modes and settings, VOCSN is going to be able to service whatever their respiratory care needs are throughout the disease progression. It also gives them the mobility that they deserve to live an independent life, both they and their caregiver. It's completely covered by both Medicare, Medicaid, and private insurance under a new billing code, E0467. Again, that is both for invasive and non-invasive ventilation. It's not important to segment out one or the other. Patients qualify if they qualify for a ventilator plus one of the 4 other therapies. Oftentimes, ALS patients qualify for a ventilator and cough assist. At that point, they then qualify for VOCSN, giving them access to all 5 therapies. They then have cough assist at the touch of a button without disconnecting the circuit, allowing them to be more compliant, to do cough therapy more frequently, without the risk of infection, at the touch of a button, with a lot less burden on their caregivers and a lot more comfortability for the patient. For any clinicians who are interested in seeing integrated respiratory care for themselves hands-on, we're happy to do an in-person demonstration of VOCSN, and then even more excited to do a patient evaluation. If they have a patient they think could benefit from the benefits of integrated care and 5 devices in one, we will provide on-site clinical training as well as our on-site staff support. To support that evaluation, we monitor the patient 24/7 over the period of 1 to 3 days to help support the patient in their transition from their existing device to VOCSN, or in the setup of a patient who is newly using a ventilator to begin to see for themselves the benefits of integrated respiratory care.